there. This is Dr. Tolu Alugo from St. John Cap, where we empower youth mental health by providing education to parents and caregivers. We're also very passionate about helping parents who look after a child with a chronic health condition to manage their emotions. So today we have a special guest. Her name is Dr. Lola Ashaye. I'm going to get her to introduce herself in further detail and then we'll start our conversation. Thank you very, very much, Dr. Lola, for joining us today. Should I call you Dr. Lola or Dr. Ashaye? What do you prefer?
Either one is fine. Thank you for having me, Dr. Tolu. It's a pleasure to be here. And I'm Lola Ashaye, as Dr. Tolu mentioned. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugarland, Texas, which is a suburb of Houston, where we help people become and stay healthy so they're empowered to live out their dreams. And I'm really passionate about health prevention, and I'm excited to talk about, whatever you'll have me say today.
Great. Thank you so much for joining us. I really appreciate it. So, in the last few years, there's just been this talk about lifestyle medicine. I mean, when I was studying in medical school, it wasn't even a thing. So now it's always been spoken about. And I'm wondering, what is lifestyle medicine? What does that mean?
Yeah, absolutely. So lifestyle medicine it's a way of approaching healthcare. It's a different way of approaching healthcare where you're primarily looking at lifestyle ways to prevent and treat chronic illnesses. So instead of, being the first stop being medication, the first step is lifestyle medicine. And I think that has always been part of medicine, that has always been the foundation. But I think there's now evidence showing how powerful it is in terms of even reversing conditions like diabetes, high blood pressure, and high cholesterol, and things that we traditionally will, do some lifestyle and then, add medication on top of. Now we're finding that with just lifestyle medicine, people can actually reverse serious health conditions. And so that's, as we have more evidence to support this, using whole food, plant based eating patterns, using physical activity, managing stress, managing sleep properly, social connections, and avoiding risky substances. Doing all these things together can be a very powerful way of treating and preventing serious health conditions. So that's kind of lifestyle medicine in a nutshell.
Right. You're right. I mean, even when I was in med school, they would talk about lifestyle changes. I know my mom was very big into walking but it was just not really appreciated or respected. People just always felt those are just like commonsensical things. But that, people would just want to go see the doctor for medication and believe that that was the answer to everything. So I'm wondering what sparked your interest in lifestyle medicine? What made you decide that this was something you wanted to get involved in?
Yeah, so, I've always been passionate about health prevention, and I think it started when I was in medical school, and I went to a school where that was very focused on specialty care, and they trained a lot of us in that way. But I just saw a lot of things very late because of that. So I saw disease present very late. And I saw how difficult it was for people, at that time. And it always made me think, even as a med student, like, what could have been done before we got here? So I was always in that mood, like, what happened? Why are we here now? So residency really made a big impact when I had a patient in residency that had diabetes. And, in residency programs, a lot of the patients come to the same place for years. So you get that privilege of seeing them, through the lens of so many different physicians that they've seen over the years. And now I could see her whole history. And when I looked at her history, it just dawned on me how simple it was to have reversed the diabetes. Now here we were. She had heart disease, kidney disease. She could barely see. She was in a lot of pain from nerve pain. She was always in and out of the hospital. And every time I saw her in the office, because I'll see her in the office and I'll see her when she's admitted, she will always be like, I wish I listened. I wish I listened. This doctor told me, I needed to do this. I didn't take it seriously. And she was always expressing regret. And so her story just really impacted me. And I was like, you know what? I felt like, yes, she had a part to play there, obviously, but there was probably more that we could have done too. So it always made me feel like, how can we prevent health conditions? Because when it gets to that point, it's just so sad because it's not just about her, it's about her whole family is affected, her business is affected, her whole life, everybody around her is affected by her illness. And so I just, it made me very passionate. So when lifestyle medicine, when I heard about it and I saw how well it fit into preventative care, it was like a no-brainer. It was like, this is exactly what we need, and the truth is a lot of people are tired of taking medication. They want they every time you give them one medication, then you're giving them another one to counteract the side effect of the one that they're taking. So they're tired of it. So if they can see that there is a path to improving their status without, in a much safer way, in a way that actually gives them more energy, makes them feel better, not makes them feel bad, they're more likely to engage in that process. And so that's when I found out about it. I was, super excited about it. And since then, I've been trying to, incorporate it as much as possible in treatment of my patients.
Wow, that is such a powerful story. I wish I listened. And I see so many people now as well in my own day-to-day life who maybe are struggling with high blood pressure, diabetes, and then you can really look back at their lives and realize that maybe in their 40s or 30s, they could have made other choices. And now they're in
Mhm.
their 70s and they're really struggling with their physical health. So I really do, that really resonates with me. But you do know I'm a psychiatrist. So I'm wondering, is there a link between our lifestyle and our mental health? Is there any link there?
Yes, absolutely. And with our lifestyle, I think people underestimate the our mental how important mental health is, because the truth of the matter is without a strong or healthy mental being healthy mentally is really difficult to do anything that we're talking about. So mental health is so important, and that's in lifestyle medicine. Actually, that's one of the first things that we try to talk about. Their readiness, their confidence level, their mental health. Because the truth is, if you don't have you're not healthy mentally, anything else that we're trying to do to help you get healthy is going to be even more difficult. So mental health is like, foundational, honestly, with anything we do with health.
Exactly, and vice versa. So, I mean, when people come to see me, I always say the first thing to start with is, are you getting enough sleep? Are you exercising? What's your diet like? So, and sometimes just making those little changes is enough to change their mental health, where they then don't have to go on medication or continue to see a specialist just because they've made little changes to their everyday lives. So now I assume that you see kids as well as adults in your
Yes,
practice.
yes.
So how do you incorporate lifestyle medicine into the life of a child? Because I'm a child psychiatrist, so I'm really, going go about the children.
Yes. Well, the children actually, I think, are easier because parents love their kids, most parents, and they would do whatever it takes to try to get their kids to conform. It's when it comes to them that it's a little harder. So if you tell, a parent that this is what your kid needs, a lot of times the parent will follow through with that, and that helps. Kids are still flexible. But I think a lot of it too with kids is just, they tend to be actually more receptive, but trying to find what they like, meeting them where they are. So, talking to them about, okay, if you say, do you like vegetables? Obviously, they're going to say no, but many of them. But if you say, if you say the vegetables out, like, oh, do you like carrots by any chance? Do you like like find out what they actually like and just say, guess what? You can eat it every day if you want, and they're excited. Oh, really? Because they like it. So they don't mind. And then trying to, when you talk about physical activity, putting it in, a sport. Oh, what sport do you like to play? or what activity do you like? Do you like this? Do you like that? So I do a lot of finding out what they already like to do, and then just really encouraging that and helping them see that, don't make it a chore or another thing they have to do. And really being very careful about not body shaming, because you don't want them to feel, that there's something wrong with them. You just want them to let them understand it's about healthy eating, healthy lifestyle, being healthy, feeling good, not about, you don't want them to get a complex about how they look, or, that sort of thing. So that's typically my approach, trying to find out what they like and really, really encouraging them to do as much of that as possible.
I really like that approach of being specific, because I think kids have this almost like a peer pressure thing or identification of, oh, I don't like any vegetables, but in
Right.
actual fact there are some that they like. So I like that strategy of being specific and asking about different kinds of foods and even exercise as well. So for a parent that feels as if, okay, I want to begin to lead a healthier lifestyle with my children, what kind of changes can they begin to implement? Where can they start from?
Yeah, so a big part of what I do too is I encourage people not to start with taking things away, because when you start there, it already feels restrictive, you know. So I always start with adding. So we talk about, oh, okay, so we've identified the vegetables you like, we've identified the fruits we like. Let's add that to your diet every day or every other day or 3 times a week, and not putting pressure on them. Let them decide how often they really realistically think they can do it. And so we focus, that's where we will start. Okay, what do you like, and how can we add it as much as possible to your diet, to your lifestyle? What do you like doing? Do you like walking? How can we add that for 5 minutes every day or every other day or 3 times a week or twice a week? We just start where we are, and how can we do that consistently until we get to the point where we can do it more and more. So I think when people see that it doesn't have to be, 1 hour in the gym, it makes it easier for them to want to do. Or if with sleep, it's like, okay, what time do you go to bed? Oh, you go to bed at midnight. Okay, let's make it 11:45 just for the next 1 month. Let's see how we can do it. And when they see, oh yeah, I feel a little better. Okay, can we do 11:30 now? So slowly trying to help them make those changes when you're very specific about what the goals are, helping them. A lot of times, my patients will write it down. We both sign it, and say, okay, here's your copy, put it on your wall. This is, where. So it's something that they're very aware that this is our goal for this month. And so they're much more likely to meet it. And I think with a parent, when you show that example, the kids over time see the example of, oh, we're eating dinner. Oh, where's the vegetable? After a while, they are asking because they're used to it. Oh, where's the vegetable we're eating with our dinner tonight? It's, what vegetable are we eating? So once you show that example over time, so slowly they too start to, start to do the things they see you do. So it's important as a parent, if you're trying to help your kid be healthy, we also have to, practice those healthy lifestyle practices too.
I think that's great. I think involving them in sometimes meal planning, if they're old enough, helping out in the kitchen may also be
Yes,
ways of, and I like your idea of, doing it a little bit at a time, because people just get overwhelmed with, I have to do 30 minutes 3 times a week. And you're thinking, I can't even walk for 10 minutes. And
right.
people they get tired and they just give up. So I
Yeah.
think that's important, that, you can really start wherever you are and gradually begin to build it up.
Yeah,
So,
I want to add, actually, I have a patient that we started with literally just put on your tennis shoes every morning. Like you don't you don't even have to, just put it on and walk to she had what's that thing called? She had some kind of machine that she had just gotten. And I
mhm.
said, just put it on, and then put it on and stand there for like 2 minutes. And then slowly over time, because it's your brain, it's a habit thing, your brain starts to say, oh, I need to, do a little bit more. And before you know it, you find yourself doing more and more and more. So it's just really starting, doesn't matter where you are, you can start somewhere and just take baby steps.
Exactly. And I always tell parents make exercise fun because if it becomes like a mandated sport, I mean, sports are great. It's good to be an organized sport if your kids can do it. But if it
Right.
becomes mandated or they're particularly anxious or self-conscious, then or it just becomes a chore. But if it's a fun thing like dancing, we dance, for example, different
Right.
games or whatever it is that will be fun for the kids, that they're more likely to continue with it and to enjoy it, then they stick with it. So I'm wondering, at what point does a parent need to get worried if they at what point in their child's physical health do they need to think, okay, I need to make changes now? What would be the signs that they would see?
Yeah. So I think it's important that children see their doctor regularly. And, thankfully, because of the school system in a lot of our countries here, that happens. And so hopefully the doctor is also looking at the child and identifying, things about the child that need to be addressed sooner or later. But yes, absolutely. There is a point where, let's say you're trying all these things and the child isn't, nothing doesn't seem to be working, or the child is not responsive to it, then you want to definitely involve your doctor at that time. Or if they're showing physical signs like, signs of diabetes, which could be going to your bathroom too often to urinate, which could be signs of insulin resistance where they have darkening around their neck. Um, that can be concerning. Or if they have, they're thirsty all the time, that can be concerning. So there are certain things, but really that because there's so many things that you to look out for, the best thing will be make sure you're taking your child in for their yearly physical at the minimum. And if you do see anything that seems out of the ordinary, you should bring that to the attention of your doctor. But because there's so much in health, it could be something about how they're developing that could be abnormal, that it's hard to know if you didn't know what was normal. So it's always just make sure the child is being evaluated every year at the minimum. And then hopefully you or your doctor can keep an eye on the child.
And for adults as well, how often should they get themselves checked out? So that they
Yeah.
can catch things quickly or make amends quickly.
Yeah, with adults, a little easier because hopefully by now you know when you don't feel well. But definitely, still, adults should be seeing their doctor once a year. And I've been very surprised by, I hear a lot of people say that they're healthy and so they don't have a doctor. And I've been surprised many times with very healthy looking people who have very abnormal tests or exams. So don't assume anything. Like I've seen a 30-year-old with atrial fibrillation. I've seen somebody else in his 30s with very, very high cholesterol. I mean, I've seen so many people that, on the outside or very high blood pressure and they feel completely fine. You look at them, are you okay? Oh yeah, I'm fine. I'm perfectly fine. And they have,
Wow.
you know, abnormalities. So it's so important not to delay your care. And I think even I talk to doctors a lot now too, because I find we are as guilty. And, because training, you're so busy, you don't get that. We don't have that culture, especially during our training, right? We're so busy with medical school, the residency, that's like 7 to 10 years or 12 years of training. And so when we come out, sometimes we just don't even have that culture of seeing our own primary doctor. And so, even for myself, after like a number of years ago, I had to like, you have to go to the doctor. So I go to my doctor every year, make sure I get my labs, do all my preventative screenings and everything too. So important.
That is so important. Like where I'm based right now, we have a real dearth, a real lack of family physicians. So
Mm.
people end up, on a wait list for years to see a family doctor. But I know that the way you practice is I mean, you're in the US, it's different. But then again, the way you practice is again different. Talk to me about your practice and how that is different from the norm that we're used to.
Yeah, absolutely. So I have a direct primary care practice, which is a membership practice. And because of that, I have a lot more time with my patients to really spend time and find out what is happening and address their concerns in a very detailed and thorough way. And so that's why I had the opportunity to do lifestyle medicine, education, talk with them, learn, get to know them well. So, with direct primary care, it's a model of care basically where it's the patient becomes a member of the practice, like a gym membership. And that gives them direct access to the doctor. We can call, text, email us directly. We have video visits. And so, because it's such a more personal way of, they have easy access to us and we can spend all that time with them. There's a personal relationship, and we can really address their concerns and prevent serious health conditions. In the traditional care system, things are very rushed, and people are in and out. They don't get that time with the doctor, and so sometimes patients get frustrated because they cannot get their questions answered in that model. So this model, I really, really feel like it helps patients address their concerns in a much better way.
That sounds like a very patient-centered approach, and I think also would help with early intervention, early detection of, difficulties. I think that's really a fantastic model. We don't have it here in Canada, so, but if we did, it would definitely want to go for. So before I let you go, I'm just wondering if there's somebody listening to this podcast, and they feel like their lifestyle is not the way it should be. What can they do? I mean, how can they get help?
Yeah. I mean, I think the first thing is trying to make sure you have the right information, because one of the things that now a lot of people, there's information everywhere. And unfortunately, some of the sources are not great or the information is completely wrong. So it's important that, when you are starting off, you're getting your information from the right source, because you don't want to start doing all those things and then it's not working, you get frustrated, and that further reduces your confidence in in what could work, but because you don't know how to go about it, it's not working for you, right? So I think finding the right information, which can be, there are a lot of doctors now online and stuff. You can follow us on YouTube, on social media, all of that kind of stuff, to find good information. If you have a good doctor, go ask them, find out more about them, and find out more about it. Make sure your questions are answered. Don't just Google something and do it. Really make sure that your source is accurate. And then once you have the right information and you keep um, feeding yourself the right information, there'll be many, you have practical steps to, you can find out what to do next. But I think it starts with, having the right information, and then hopefully finding the right person that can help you through the process in some cases. But I think information is powerful, so it needs to start there.
So you mentioned, finding the right information. I know you have a website, and then you're also on social media. I'm just trying to make sure I have it here on the banner. So at In Touch Primary on Facebook, on Instagram, and then it's In Touch Primary Care on YouTube. Am I right?
That's right, yes.
Yeah. Okay. I'm just gonna edit my banner here so to make sure that we have the right information. So if you guys are looking for any information, just go to any of these places: YouTube, Facebook, In Touch Primary Care on YouTube, In Touch Primary on Instagram and Facebook, and also on the website, and you can get information. And if you're in the Houston area, you should check out Dr. Lola, because she would help you to get your lifestyle on track and get you the help that you need to make yourself really healthy. So before I let you go, do you have any final words of advice for us, for our audience?
Yeah, no, just want to say thank you to you, Dr. Tolu. And I know that you have a practice over there helping children and parents to be healthy mentally as well, which, like I said, is a big first step. And so, just wanted to say thank you for having me. And I know your patients are lucky to have you.
Thank you very much for coming. I really appreciate it, and hopefully we can chat again soon because obviously our two areas of specialty really interact a lot. So really we'll have a lot more to talk about. Thank you very much, and
Yeah.
we'll be in touch. Thank
All
you.
right.